Plaques that were found to be abnormal in Alzheimer's were also present in Lyme disease patients. Also with multiple sclerosis, over 18 publications because they said that Lyme destroys what's called the myelin, which protects our nerves, and it attacks it. And in that process, you get the complications of multiple sclerosis, which is secondary to the exposed fiber, and that happens secondary to the Borrelia attack. Okay? So that's the same thing that happens in multiple sclerosis. And ALS, or Lou Gehrig's, which is a disease that shows problems with both upper and lower neurons. Patients have muscle weakness, paresthesis, which is kind of numbness, tingling. And they showed in this paper, which I thought was fascinating, that 3 out of 24 patients diagnosed with ALS improved with IV Rocephin, which actually treats Lyme disease. Okay?
Is
So I...
Is it an antibiotic?
Rocephin, yes, that's an antibiotic that treats Lyme disease. And I've actually, probably every Lyme specialist here in the world has seen patients like this who come to us with other diagnoses and had a Lyme component to their clinical manifestation. I actually have anecdotal evidence of a patient who had this ALS presentation and also improved with parenterals. And how did we treat this? Okay, and we know that this is definitely a chronic illness, and unfortunately, there's no cure. And remember earlier, I told you about how complex this disease is. And it also you want to get remission, okay? And I tell all of my patients that this is a chronic disease. It definitely has a waxing, waning course, but our goal is to gain remission and to keep you there. Now, some of the possible adverse effects of Lyme treatment is what's called the Herxheimer reaction, which a lot of patients say, well, I feel worse before you feel better. And it's just secondary to all of these kind of toxins that are released in your body when you kill bacteria, okay? And those toxins can just exacerbate Lyme symptoms, neurological symptoms, musculoskeletal symptoms. And then if you think in regards to the nervous system, I stated earlier that there is a psychiatric component. So a lot of patients can have worsening of their underlying psychiatric disease. So that's always why we should address that. We have publications that show that that's definitely evident, and we know that patients can have what's called Lyme rage, where they're angry out of nowhere, and it's not just out of nowhere, it's secondary to this underlying infectious process, or worsening depression, suicidality, more violence. And it's not that it's separate. That's kind of the misconception. It's all together, and that's one of the reasons why we collaborate so much at my practice with the Amen Clinic, because we have that baseline understanding. And also remember, detoxification is very, very important before you start any treatment. And you want to make sure you start slowly and you monitor closely. And we try to start just with kind of a comprehensive, holistic approach. You do your initial screening, making sure you rule out biotoxicity or exposure to different things in the environment, or just overall production of toxin. That can be with our questionnaires. Make sure you kind of evaluate and interview regarding possible heavy metal exposure. Make sure you start herbals and get patients in regimens that can help their body detox, like anti-inflammatories, liver, kidney, lymphatic detoxification, what's called free radical scavengers, which are agents like glutathione that can kind of bind the toxins in the body, vitamins, okay? But sleep sleep is very, very, very important because if your body's not resting, your body's not healing, okay, you're gonna be tired. So we need restorative sleep and feel refreshed in the morning. So to do that, to achieve that, you have to really evaluate, well, why is this patient having fractured sleep? So you gotta make sure you look at the pain, make sure you assess the sleep hygiene, make sure you assess the mood, try to reduce stress, improve the mood, decrease anxiety, and make sure in your evaluations and interview that you evaluate for sleep apnea, because we see that a lot. And you want to really make sure you also treat the gut, because 60 to 80% of the immune system activity in humans focus in the GI tract. So you want to kind of try to remove unhealthy bacteria. Some patients, and mind you, this isn't standard for every patient. These are just things you want to make sure you think about as a clinician and as a patient, also things to think about. But you want to make sure you remove unhealthy bacteria. In our practice, when we have patients that we're concerned have GI complications, we will do a test that's a stool test to look for a yeast overgrowth, bacteria overgrowth, parasite. You want to make sure there's a good probiotic on board, that the bowels are moving and functioning. I just told you this disease causes what? Toxin production, so you want to remove those toxins. And removing toxins from food, okay? Making sure food allergens have been evaluated, making sure you look and evaluate the nutritional deficiencies. Then you think about, okay, let's treat the underlying infection. Now, there are no guidelines regarding the duration of Lyme treatment. We just don't have firm guidelines at all, okay? We treat based on your clinical diagnosis, and it's really based on a physician's clinical judgment. And like I alluded to earlier, there are co-infections that need to be addressed. Some of the treatments includes antibiotic protocol, herbals. There are also alternative forms of treatment, hyperbaric oxygen treatment, which is something we use at our practice. And you also want to make sure you reduce the stress on the body by doing the pain control either with medications or physical therapy, holistic approaches, acupuncture, massage therapy, lymphatic drainage, Epsom salt baths just to sweat. Saunas can be helpful in some patients. Some patients find a lot of benefit from craniosacral massages. Make sure you treat and evaluate the endocrine system, which is responsible for metabolism. So thyroid level, cortisol level. Make sure you strengthen the immune system and improve the mood and stability. And I like to look at it at coping with the double L's, life and Lyme. Recognize your symptoms, find those supportive people, family and friends. Make sure you prevent ticks. This is that time of year. So if you don't know about tick prevention, this is the time to learn. You can ask me afterwards, I'll be here. But more importantly, spraying or finding a DEET product to protect yourself. Find yourself a Lyme literate or even a Lyme sensitive physician. And really encourage someone else. I hope you all leave here today. We do have a great panel with just some information to share with family and friends. There are organizations like ILACS, like NetCap Lyme. And just stay optimistic. This disease is complicated. It does affect numerous different systems. It is challenging. It does wax and wane. But it's a good power to have that good spirit about it as you go forward with this fight, because it can be hard. That's why it's important to have that support. And losing is not an option. You gotta remember that as you go through and go forward. Thank you. I have callers also on the table outside. If Sorry.
I actually have a couple questions. One is, do you happen to have a copy of the PowerPoint?
I do have one. If interested, it's on the computer here. I'll provide it to you as well, or I don't know if I can give it through the Amen.
Well, yeah, maybe if Larry,
the email address.
That'd be awesome.
Yeah.
Okay.
to who should they give the email address, Larry? To you or?
Yeah, just
or leave it.
Can you just email it to everyone who signed up with their email?
Right, just need to email. That would be great.
Yeah.
That would be awesome.
Thank you.
Yeah.
And we all want it.
You can have it.
The other couple questions I have, one is there, do you know a specific best test to take if someone's showing symptoms and they're not sure if they have it? I mean, obviously Western blot, a lot of false negative. I've heard
Right.
CD57, C4A. Are those the two you would recommend? Is there another?
Yeah, IGeneX is a laboratory that is more sensitive than the Western blot that we find from LabCorp.
So isn't
West.
IGeneX a lab, not a
That's
test?
a lab test. They do Western blots for not only Lyme, but all of the co-infections as well. That's a more sensitive test. It's out in California. They also have cultures, and they have additional tests on the horizon. One of the cultures is from Advanced Labs. They have cultures that you could, that are available. But still remember, and CD57 is a good test to give underlying information about the immune system. CD57 represents what's called natural killer cells, are cells that naturally fight off infections, and it's found to be low in a lot of Lyme patients. So, but remember, those tests may not be positive, but they're out there and they're available.
There's one other question. What does your practice do?
My practice, we're Lyme specialists. We work with chronic Lyme, chronic fatigue, fibromyalgia patients.
So would you be in lieu of, instead of an LOMD, or you work in concert?
No, I am an LOMD.
Oh,
I am
okay.
a Lyme literate
okay.
physician. Yeah, so yeah, that's what we are. That's what I am, and we also.
That's all you do.
Right.
Yeah.
That's
Okay.
we do. That's the majority of
Okay.
what we do, and we also have our hyperbaric center. So I am a Lyme literate
Can
physician.
you hear me, Russ?
I am here with Breston. I do have my card outside. We are taking new patients if interested. Oh, that was your question. Yeah.
And I'm our publicist.
Yeah, and we're a growing practice. It's myself. We have another nurse practitioner, and bringing on another associate. So we will be taking new patients.
Do you take insurance?
We do not take insurance. We're not affiliated with insurance. Yeah, thank you.
You know, I don't know how sick people are that are here, but I have an unbelievable version of Lyme that I think is going to kill me. And I have Lyme literate doctors, and we've been gone all through this. So basically, my disease started in 1976 and it exploded in 2005. I have multiple exposures. And my question now is, well, this stuff is really difficult and confusing. And now as my Lyme continues, my brain capacity is becoming less and less.
Yeah.
I can't manage this.
Yeah.
I literally cannot manage it.
Yeah.
Where does one go? I mean, right now, I had comprehensive care at the beginning, which was very useful. And now, because it's so bad, I'm out in the world with all of these specialists, and I can't teach them about this. Where do you send doctors to get the information that you just gave me in 5 minutes so that they can have some clue that we're not making symptoms up for? I mean, where's that way?
And if I could answer that question, I would be the best person in America. I wish I could, but we send them to ILADS, and it takes people like you to keep advocating. That's why we have these laws that are being passed. But one of the best websites, www.ilads.com, is very helpful. But physicians, we have to have those that are open. But I've been surprised about a lot of the physicians who are now becoming Lyme sensitive. I have collaborated with quite a few physicians in this area, and it seems that hopefully there's becoming a trend, I hope, to learn more about this among the health community. And I think especially starting with this new legislation, it's going to be imperative, because even with those, if you have, specialists in Virginia, they're going to have accountability. So it's important that we realize that this is a process and evolution, and we stay committed to advocacy and teaching, but it's just going to take us reaching out.
Well, it's interesting you mention that because I come from Maryland, and I think I'm the first person in Maryland to get disability for Lyme.
Wow.
And that happened in 2006.
Yeah.
So that was pretty early. So I was shocked because my doctor didn't want to write Lyme. And I was like, but that's what's killing me.
Yeah.
It's crazy not to write it. But it is happening, but might not be fast enough for some of it.
So, like I stated earlier, I learned that exam in college, being a neuroscience major, and it's based on the evidence. Like I stated earlier, as doctors, we need the evidence. But we have to remember who provides it. And also, if you think about it, as a physician, we want to know the direct answer. Yes, no. Things should be black and white. But when you have a disease like Lyme with so many shades of gray and so many nebulous symptoms, it's really difficult for that evidence-based test to assess that patient. So I think the answer for you is the reason why there's so many abnormal neurological testing results is because that test is standardized and the symptoms of Lyme disease, they're not. So it won't really be relevant in a lot of patients' cases or interpreted, appropriately by the physicians. Regarding following up and teaching others, another thing I always tell my patients is get your arsenal, get the literature that you need, ask me the questions that you need. And one of the other questions we ask our patients when on initial meeting, who do you want us to send this to? Is there anyone you want us to send us to? Because we provide literature when we submit, our evaluations to other doctors. We always welcome the idea of collaborating or just teaching. I don't know how many doctors I've sent notes to or had reach out to me, and it's hard. It's going to take time, but it's happening.